name is William Pierce. I go by Billy, and I have the honor of serving as the Associate Vice President of Alumni Engagement at the University of Toledo. And I'm also the liaison with the University of Toledo Retirees Association, who is the sponsor of today's event. Really excited to present to you today the topic of current trends in physical therapy. We have an amazing facility here in town. Actually, got quite a few facilities in town and a few throughout the country of some amazing professionals, many of whom are alum of the University of Toledo. But right here in our backyard, we've got a great resource of information, and looking forward to their presentation here today. Just a few housekeeping items before we dive in. If you could please keep your microphone on mute. It is extremely helpful as it cuts down on background noise and we don't get any interference within the presentation. For those who submitted questions prior to today during registration, those have been forwarded on to our PT Link friends, and I'm sure they will address those. However, if there are questions that come up during the presentation, please feel free to put them in the chat window, and I will make sure that your question is conveyed to the team. So I'm going to check and make sure Joe is ready. Yep, thumbs up. All right. So just a quick bio so that you know who you are going to be watching today. PT Link Physical Therapy was formed right here in Toledo 8 years ago by a local physical therapist, Thomas Hallett and Michael Coulter. As the company grew, they added a few partners to their group: Samuel Rakita, Eric Schneider, Christopher Lovejoy, and Amy Knesny. The team has enjoyed continued growth with 12 locations throughout the greater Toledo area. And they attribute their success to the wonderful education and the majority of their partners, majority of their partners who are from the University of Toledo, and you'll meet a few of them here today. PT Link is also proud to support the University of Toledo Athletics Department annually. So without further ado, I'd like to introduce you to the person I've worked with to help get this set up. He serves as the Business Marketing Manager at PT Link Physical Therapy. And I will turn it over to Mr. Joe Szafarowicz. Joe? And Joe, your mic's on mute. Oh, there you go.
I got it. Well, good morning, everybody. Thank you for tuning in. We're really excited to be part of this. Thank you, Billy, for reaching out. And again, thanks to Pat Russell. She's been instrumental in putting this together with us. So with that, I'm going to introduce you guys. Let the PT League team introduce themselves. And they can kind of explain, their relationship with the university, and then we'll get into showing you guys some treatment options. So here we go.
Did they get the bio?
He just did, yeah. Billy, we froze at our end, so I wanted to make sure everybody else didn't see it, but I want they were able to hear the bio of the company and stuff, but we froze real briefly there. So.
I'm not sure if anyone didn't hear the bio, if you could just put something in the chat window. And actually, if you want, maybe I'll just go through it again just to make sure, because I don't want to shortchange you guys.
No, so I appreciate it. It's not that. We froze, so we got nervous.
Okay.
Hi, I'm Sam Rakita. I'm a 2006 graduate with a degree in exercise science, and then a 2009 graduate with
from University of Toledo.
Oh yeah, from the University of Toledo, and then a 2009 graduate from the DPT program at UTMC.
Hi, Chris.
This is Chris Lovejoy, 2006 graduate of another MAC school that we won't mention, and then a 2009 graduate of the DPT program at the University of Toledo.
And I am Mike Coulter. I'm a graduate of the University of Toledo Physical Therapy program, way back when it was just physical therapy, in consortium with the Medical College of Ohio, way back in 1993. So it's been quite a while. So I've been a therapist for, I think, going on 27 years or something like that. It's getting a little crazy. We're very excited to be able to talk to you guys today. We have been huge supporters of the University of Toledo for a few years now with the athletic department. and really enjoy University of Toledo athletics, as well as, I think us, as well as all of our family members, have been to University of Toledo, and we just think super highly of UT, and very fortunate to be in an area with such a wonderful school. And I'd just like to thank everyone for being here today. We were asked to talk about physical therapy and some of the trends that we're doing currently, and that you might see in any physical therapy clinic that you might go to that's newer, that hasn't been done in the past. But I wanted to talk a little bit about physical therapy in general. My friend Pat, that helped us set this up, asked for a little bit of history on physical therapy, and I actually was going back and just reminding myself of some of the history, and realized that physical therapy has been around actually since like 1813 in Sweden. They were trying to come up with something like a physical therapist to help gymnasts that needed work. And so then where it really became physical therapy in the United States became popular is more during that World War I time, both for treating people with polio, and then later for post-polio, but also for people that were injured in World War I. And then I think in 1921, the American Physical Therapy Association was developed, which really helped to kind of push physical therapy along as a profession. And then in World War II, physical therapy, we weren't called reconstruction aides anymore. It started to be called physiotherapists or physical therapists. You might hear those words are synonymous. They're the same things. And physical therapy has just continued to just become more and more, mainstream. When I went to school, it's funny, I went to school at University of Toledo. I changed my major about 4 or 5 times. It took me longer because I didn't know what I wanted to do. I didn't even know what physical therapy was. And then I hurt myself working at UPS in my back. I was sent to a physical therapist. Like, wow, this is really cool. I knew I wanted to work with people, but I didn't know what physical therapy was. So that really helped me to kind of nail down what I wanted to do. And it's come so far since then. For example, when I first became a therapist, you had to always have a physician's referral to come to physical therapy. And now, a lot of times we can be your first source of contact with a lot of insurances where they will continue to pay, but they don't require a physician referral. So that means we're kind of, a lot more respected now, I guess, as practitioners than we were in the past, and just recognized as a primary source for treatment for a lot of people. So we're very fortunate for that. And with that, we've just continued to grow with a lot of really cool techniques and things throughout the years, which is just, more and more research being done on a lot of things that help people get out of pain and improve their function. So, at PT Lincoln, as well as any other physical therapy place, we always, our primary goal is to help people in pain, right? So people have back pain, they have neck pain, shoulder, knee, ankle.
Hey, Joe, we got you. Something happening and your microphone's on mute.
Are you better now? We good?
Where do you lose me?
Yep.
All right, sorry about that.
Where'd you lose me, Billy?
About 30 seconds ago.
Oh, okay. I was just talking about how with physical therapy, number one, how we've become a lot more autonomous, but we, as a first point of contact for people to be able to come and see us for treatment. And then, what our goal in physical therapy most of the time is when people come in, they come in with, I'd say the majority of people come in with some sort of pain, either back pain or neck pain or shoulder or knee or hip or ankle. And, it could be from an injury, it could be from surgery, could be from something congenital that they were born with. So we try to help to decrease that inflammation, get rid of that inflammation, whatever's causing the pain, whether it's from a disease process or the injury like we talked about, and get them back to fully functioning, get them back to work, get them back to being able to pick up their babies, getting back to being able to walk and exercise or play sports. We also, in physical therapy, we help people that have problems with walking. They might have, some type of issue with their gait, where they're, because of either weakness or pain or other issues, where we try to teach them how to walk appropriately so they don't develop other problems. We see a lot of people that are dizzy, that have vertigo, or where the room is spinning, and we have a lot of different techniques to try to reorient these little crystals that are in your inner ear to try to get you back to where you're not feeling that dizziness or that room spinning problem, which is miserable for a lot of people. And sometimes it's amazing the techniques that physical therapists are able to use is sometimes 1 or 2 treatments and, you know, months or years of that room spinning problem, that vertigo, can be taken care of just like that. And so those are really exciting for us when we can help people with that. And physical therapy, I mean, we use all the traditional things. We look at people's range of motion and, you know, of their backs and their necks and their limbs, and to try to restore that. We have a lot of different techniques that we might show you a few of today. We work on strengthening to try to get those muscles strong again, whether it's in your back or your core or your hips or your arms, to get you back to being able to function. But we also have a lot of really cool modalities and things that we'd like to talk about today that really help to decrease that inflammation that we were talking about, and to try to, you know, by decreasing inflammation, we're then going to decrease pain and improve function overall. So what would you like to talk about first, Sam?
Well, we can go over here. We can show you guys some of the different newer age treatments that we can do. We'll start off with one of the newer ones that probably most people have never heard of before, and that's blood flow restriction. May sound kind of scary because we are cutting off some amount of blood flow to an area. Typically it's one of the limbs or both of the limbs, the arms or the legs. But what basically blood flow restriction allows us to do is, by cutting off blood flow, we can allow the muscle to fatigue a lot quicker. So we can, for someone who comes in, say you have elbow pain, typically for the long-term improvement of elbow pain, after we reduce the inflammation, we need to get these areas stronger. But if you're coming in and you're in pain, it's really tough to strengthen yourself when you're in pain. What this allows us to do is we put these cuffs on, and it's basically like a tourniquet. Yeah, you can put it on. It's basically like a tourniquet, but we put it here and we pump it up. Now, in an office situation, we're actually using a Doppler, so we're monitoring blood flow while this is on. And in the upper extremity, we usually will restrict blood flow up to about 50%. And by restricting that blood flow, we're able to use lighter weights and still be able to cause fatigue to the muscle without putting extra stresses through the area that's injured. And with that, we have physiological effects. We have lactic acid buildup and some different things like that that trigger different processes in the body, where you can get improvements in healing, which can help the process happen a little bit quicker. And then also improvements in, there's been shown to have improvements with bone growth. So if you have a fracture, we've even used these in the past. And overall, it can be a very effective treatment for that. We do have a lot of athletes that use these, but we've used them on just about almost every population. Younger kids, we've used them on probably ages 13 and up. Older population, there's walking programs where we put them on their legs and we have them walk for a little bit, and even that has shown an increase in strength in musculature and overall improvements in endurance. So
it's amazing. From just when I first did it, actually, Sam was the first one to kind of bring this to our company. And when Sam first hooked me up before we really started using it, I remember having only like a 5-pound weight in my hand, and it was so hard to move, right, you know, after like 10 repetitions. So it was really great. It's really neat how that works.
Right. And sometimes, do you want me to pump it up? Mm-hmm. Okay. So we let's see, we'll hook it up here. Maybe. Got it for me. Got it caught. Here we go. So we have a little gauge here, and it's like a blood pressure cuff, really. And this is a thinner tourniquet. But basically we pump it up. We would already know what level we would need to pump it to. And you can see it's tightening on me. And you'll be able to see, I'm pretty veiny. So you'll be able to see that my blood flow, it's going to be restricted going back towards my heart. So my veins are going to start popping out a little bit more. And this is probably, for me, it's probably roughly about 50%. It's not painful, but even just having this cuff on, eventually, probably within 5 minutes, my arm will feel like it's getting tired. And that's without really doing anything. So as I sit here and work, I can even just move through ranges of motion. My arm will start to feel very fatigued, and obviously I'm not putting a ton of stress through the area, and we'll start to get a physiological effect that would be similar to if I was lifting a very heavy weight. So just a cool little technique that has been, shown to produce. And just to give you an idea, there's 1,100 studies on what we're doing here. Very, very positive responses on it, and we've been successful with this across the board with many of the patients that we've worked with. We've even used it on post-surgical patients. Say you have a total knee replacement or an ACL tear. We've even used it post-operatively to help with strength training, different things like that, because you're in such a minimal state right after surgery. So that's one of the real cool ones that we've just recently, probably within the last 2 years, started to adapt to, and we're trying to use it more regularly across all of our clinics.
You want to talk about that?
Yeah, go ahead.
Okay. Another technique we're using here at PT Link, and I'm sure they use it at other facilities as well, is cupping, or another word for it is myofascial decompression. It really blew up after Michael Phelps in the Olympics. You saw all those cut marks on his back. We've been doing it for a while before that, but all of a sudden I had patients coming in left and right saying, "What is this cupping therapy?" And I would have to tell them, like, it's not going to let you swim like Michael Phelps. But yeah, sure, we do it. So what they are is little suction cups. They vary in size here, and they go on various different parts of the body, depending on what's hurting, where you're having inflammation, and where you're tender. So what we'll do here is, I think Mike here is going to lay on down. I'll put some on his back, and we'll explain the process as we go through it.
So while Chris is putting this on, many of the treatments that we do are typically, if you think of like massage or like a trigger point release, they're very compressive in nature. This is the exact opposite, where you're going to be able to see this, where we're actually decompressing the tissue. So you can see skin there. And it's basically pulling the tissue away from the underlying structures.
And that helps increase blood flow, helps decrease inflammation, tissue tension, helps you feel better quicker.
Is that painful for the patient?
Most patients feel a little pinch at the beginning, but that sort of releases over time.
Right. And Mike's a great example here, because you can see, obviously, it's turning like a reddish purple. That's blood pulling to the area.
It's not, I don't feel any pain whatsoever. So, it's, a little bit of pressure.
Right. Yeah. Pressure would be a good word to describe it.
And then you can do as many as you want, as little as you want. And then you let them sit there and do their work for about 3 to 5 minutes to maximize the benefits from the cups.
So another thing you can do here too, so this would be static cupping. So we're just putting the cups on you and just letting you sit there. You can also move with these on. So go ahead, Mike, get into like a quadruped position. So he's going to get on all fours. So say your back's really tight. So now we have this decompression happening here, and then we can have him do some exercises. So go ahead and do it. You can move, do like a cat camel. Good. And then bend up, round out a little bit. You need to work on some of that flexion there.
I'll come up a little higher.
So he's moving.
Although I am the tightest physical therapist known to me.
Yeah. So he's moving. The cups are staying on, and he's actually going to be increasing blood flow even more because he's moving. His muscles are working, and he'll be getting a little bit better stretch, because as he's stretching, the cups are doing their thing as well. So it's pulling on that fascia, and usually we can get, actually you can see that it's even turning a little bit more red as more blood flow comes to the area. And we do this on numerous places. This is obviously his low back. We've done it up here through the mid back and neck.
Right, we're doing. I did a couple on elbows. We have different size cups for smaller areas of the body. We've done anywhere on the body.
Good. Yeah.
Oh, go ahead.
Yep, and just take them off. They come right off. Now they occasionally will leave marks, but they go away fairly quickly.
It actually feels very
Yeah.
good when you take these
Yeah,
off
the
because
release.
you can really feel that release and that tissue kind of decompress.
So here's another question for you. So if you have a patient that needs to get that done multiple times, is there a certain duration of time that you would wait before you would administer that treatment on the patient again?
No, I actually will do it every time the patient comes in, as long as they're feeling benefit from it and we see results. There is no time they have to wait in between.
All right, well, let's talk about some dry needling.
Go back again.
Yeah, where's the?
Right here, Mike.
Right behind.
All right, so go ahead and lie on down, Sam. So what we're going to talk about right now is some dry needling. So it's another thing that kind of scary for a lot of people, but it really is. It's an amazing process. Probably the number one thing that I think that I've ever added in all my time as a physical therapist, which made the most difference from people that have had physical therapy, at other points in their life that have come in, and then we did dry needling on them. I mean, whether it was for a foot problem on the bottom of their foot, to their low back or neck pain, muscle spasm, whatever. They have said so many times, wow, dry needling is the most amazing thing. I feel so much better afterwards. And sometimes it takes a few times, sometimes it just takes a couple times. But it's an amazing thing, actually.
Hey, Mike, before you get into dry needling, there was a question that came in around cupping, and it was, is cupping recommended for lymphedema, and what techniques help to improve lymphatic flow?
Sam, you got any?
That's probably more patient dependent. Sorry, I'm laying here while I'm talking to you guys. So with lymphedema, there's probably some contraindications depending on where the lymphedema is. We typically do not use cupping on lymphedema. Could you do it away from the site, and could there be some benefit there? That's a possibility, but that cupping for lymphedema is probably not necessarily what we would use cupping for. I wish I had a better answer for you there, but just in general, we usually don't use it on lymphedema.
Yeah, I'm sure the person that asked that question is pretty aware. I mean, the recommended treatment still for lymphedema more than anything else is the pneumatic or intermittent compression to push that, or even static compression, where you're gradually, if you have lymphedema in your leg, for example, you're going to put tighter wrappings around at your foot and gradually less and less to try to push that fluid back up towards the heart and out of your limb. So, that's some of the things that are typically done. Have we done cupping and some needling? Yeah, we have in more minor cases with lymphedema, and I've seen it to help, but it's not really one of the big recommended treatments for that. Wouldn't you agree?
Yeah,
also.
Yeah, because with the decompression, one thing that we would be worried about is potentially like if their skin is a little bit weaker, we wouldn't use it in those cases. And a lot of times in those areas of lymphedema, the skin, may be a little bit more apt to breaking. So we want to be cautious with that. But like Mike said, we do different techniques for like lymph massage and some of the intermittent compression. And that's a lot of times more of the recommended route there.
Yeah.
Thank you.
Well, great. Thank you so much for the questions. So back to dry needling. Dry needling it's called dry needling because these little needles inside, I'm not sure, Joe, if you can you see that on me?
It was better on your shirt.
Right here? Okay. Actually, let's try it on Sam's shirt. Can you see that? I'm just gonna.
Yep.
Okay, so they're super thin filaments. And so they obviously, they're not thick like a hypodermic needle where what you would use for, taking something intravenously or for giving blood. So there doesn't need to be, any fluid flow. So that's dry. It's just a small microfilament. And because of that, people don't really feel too much with this. I mean, sometimes, you know, you get some little superficial nerves and you might feel a little bit of a pinch, but it's nothing like having a big needle stuck in there if you were getting a cortisone injection or something like that. So we have a lot of really good results with dry needling, and a lot of people that really aren't fans of needles, me being one of them, are great with dry needling. But it really helps you a lot, because what your body does, I'll go ahead and put one in here so you can see. Let me move it up a little bit. So I'm just going to go ahead and push that needle in like that. So what your body does with the dry needling is it says, whoa, I was just cut by something. Well, it's that really super thin filament. And your body's response to that, to try to heal the cut, is to send increased blood flow to the area. And by sending increased blood flow to the area, it's pushing that inflammation that's causing the pain and problem, it's pushing it out of there, pushing it back into the bloodstream. And then with that, you're bringing in new oxygen and new nutrition with the new blood flow to make that area healthier. So a healthier environment down here is going to hurt, you know, a lot less. So, and is going to heal a lot quicker too. So we can do this post-surgically. We can do this, you know, with back or neck pain, with joint pain of any kind. Like I said, on the bottom of the feet works amazingly with plantar fasciitis or Achilles tendonitis in the back of your heel, and people have that. And it's just amazing, amazing results.
And I don't want to interrupt Mike, but also we can do it with like acute injuries that are more recent, just to help that healing process jumpstart and get the patient better, feeling faster. Say you run your elbow into something or you sprain your ankle, we can use the needles around there to jumpstart that healing process to get like athletes or anything like that back into sport quicker.
Yeah, and Sam, what do you feel like
Go ahead, Billy.
There's a question that came in and asked, is there a need to disinfect the surface of the skin before breaking with the needle?
So through our training, it's always, we always could, but with the research that's been done, the infection rate is almost none without disinfecting the area. All the needles are sterile, so they come in a sealed, sterile needle. You can show that.
Yep.
And they're sealed. And by the way, obviously, this is not hurting me as I'm sitting here talking. I actually didn't feel any of the needles that Mike put in, but because they're so small, also that's what decreases the risk for any type of infection or anything like that. So, and knock on wood, we've not had any issues like that. So,
Thank you.
Yeah, so dry needling is just, like I said, it's just one of the.
What's the difference with acupuncture?
Oh, was that one of the questions?
Yeah, one of the questions that was emailed was the difference between dry needling and acupuncture.
Okay, and I know right where that question came from. Thank you, Pat. So the biggest difference, so these are acupuncture needles. So they're the same ones you use for acupuncture, but the biggest thing between acupuncture and dry needling is the actual reason why you're doing it. So acupuncture, which works very well for a lot of people, works with the interrelated systems in your body. It's basically a ancient Chinese theory behind it, and it works with your meridians in your body and your qi and these, a lot of invisible things in your body that we can't really see. Whereas dry needling is more based on just the science, the anatomy and physiology, and what we're trying to do to increase blood flow. Along with increasing blood flow, we can help to decrease muscle spasms. Because sometimes you can see like a muscle, like let's say basically sometimes in the upper traps up here in the neck, you can see this really strong muscle contraction where somebody's having a lot of pain, and you put that needle in and you can just see it melt away. And so that's what also another benefit of dry needling too. So a lot of really great results with that as well. So, but really that's basically the biggest difference between acupuncture and dry needling. Acupuncture has a lot of other benefits that we couldn't do with dry needling, like weight loss or smoking cessation, and that we can't do that with dry needling. But with dry needling, we're actually trying to target certain muscles, certain parts of the joint, certain nerves. So yeah, we're that's basically the biggest difference. Yeah, but they are acupuncture needles. Any other questions with that, Billy? Let me go ahead and take these out. So I've got gloves on.
This topic.
Oh, okay. So I've got gloves on. Sometimes, every once in a while, there might be a teeny tiny little, droplet of blood. I would say 99% of the time there is no blood with dry needling. They're so thin, and that's one of the reasons why that there's no infection with dry needling, and why we don't have to worry about sanitizing the skin. But if there's visible dirt or anything like that, like the bottom, we're washing that off and we're cleaning out, disinfecting it and that. But like in the low back and neck, there's no reason to do that.
What would be the length of time someone would undergo that treatment? So the cupping, it was a couple minutes. So
Yes. Oh, go ahead, Chris. Yeah. I mean, it's patient specific. Some patients prefer the needles be left in longer, where some prefer less time. Usually it's 1 to 3 to 4 to 5 minutes based on what we're doing. Now, there are some other techniques we can do with the needles, including pistoning, where you take the needle in and out a couple times just to help increase blood flow, or tenting, where you twist the needle and then it actually makes what looks like a tent with the skin and the tissue and the fascia, and then that actually won't release the needle until that area has relaxed. Or we can hook it up to electrical stimulation, which literally amplifies the needles and causes the muscles to contract, increasing the blood flow to the area and actually amplifying the response. So depending on what type of treatment we're doing, if we're doing anything extra with the needles and what the patient prefers, that's what depends on how long the treatment is for, how long we do the treatment for.
Right, and we like to do a lot of things research-based. So a lot of our treatments, there are numerous papers and studies that give us feedback on how to treat. And when you look at treatment times with the needles in, I know acupuncture, typically you're more relaxed and you're there for a longer period of time. But from the research that we have a study that was done that showed different times that the needles were left in, and they went from, I think, a span of like 30 seconds all the way up to 30 minutes. And they really didn't see a difference in the outcomes throughout any of those times. So basically, once the needle goes in, it's technically effective. And so we really haven't found any specific amount of time that really makes that big of a difference. It's really just about getting the needle in the plate, in the spot. So if we have a patient that maybe is a little bit more on edge about the needles, I've even in the past put the needle in and then take it out right away, and they still get results with that. Yeah. So the next one that we're going to talk about, and there's some different names for this. This is a rock blade. Looks like brass knuckles, but we call it instrument-assisted soft tissue mobilization. And there's other terms. Graston is another one that's commonly thrown out there. Slide forward a little bit for me. And, so what this tool does, there's different, if you look at it, there's different bevels on it. So some are a little bit more rounded, some are a little bit more pointy. You even have some different edges down here. But basically what we can do is use this blade to help to reduce tissue tension. And if you think of the anatomy, you have skin, you have fascia, and then you have muscle underneath. A lot of times when you have pain, so say Chris has some pain right here at his elbow, where there's inflammation, you start to have all those tissues stick together. And with this blade, we can help to separate them to allow those tissues to move a little bit more normally, and then also to allow that inflammation to move out of that area as opposed to everything being stuck together. This looks like this tool would hurt, but we can use it in a way where you may feel it, but it should feel kind of good because we're starting to get some of that tissue moving around. But basically what we would do is we would put this on the skin, and we're going to move it slow and just kind of work down through the area. And we can even kind of come down here, move through there. And what you'll start to see is his skin's going to turn a little bit red. And that's, again, blood flow, because we're always focusing on blood flow. We want to increase blood flow to areas. And over time, as we do this, we're going to start to get some of these tissues to be able to move a little bit better. And it's tougher to see on a healthy area, But for instance, say he has some tightness in his back, and you can start to see some of that redness starting to come in there just after a couple swipes. But say he has some tightness in his back, you'll see that muscle that's kind of in spasm. And if you move the skin and kind of assess that tissue tension, the tissue wouldn't move as well. You rub this over them a couple times, all of a sudden we start to see those tissues sliding and gliding a little bit easier, and he's gonna feel a little bit more mobile after doing that. Very effective tool. We've used these a lot more over the past few years. As Mike kind of said in the start, many of these things, even when I was in school, I guess it's been 10, 11 years now, many of these things weren't around. So we've come so far in all these different instruments that we can use to speed up the recovery process. And this is definitely one of them. And also it saves our hands. We have to use our hands for a long period of time. And these tools definitely help out with us being able to do this all day, every day. So this is a great tool for that. Might as well go into some of the other soft tissue tools.
Yeah, speaking of saving our hands, we have some tools called like a hypervolt. This is what I explain to my patients as like a little bit of a massage gun. So we use this tool. It's got varying settings based on intensities. And I'll show you how it works. This is the lowest intensity. And I'll show you how it works on Sam here. Just a little massage gun here. Whereas in the past, we've had to use our hands constantly. By the end of the day, if you work on 14, 15 patients in a day, you go home and can barely eat dinner because you can't pick up the fork. So this has really helped. And it's concentrating on blood flow. Say we're working on Sam's neck or upper back here. You just get in there with the tools here, or with the hypervolt here, and it works the areas, both rhomboids, upper traps, and this vibration and increased pressure in this area increases blood flow. That helps decrease tissue tension, get that inflammation out, helps Sam feel a little better quicker. Again, we can work on any area of the body that we need to. Try and avoid the bony prominences because that doesn't feel good to go over bone. So yeah, and like I said, it's very intensive. This is the lowest. Here's a medium intensity. You can see just the increased vibration setting through here. And there's varying tools. This one is the massage gun, and this is the highest intensity. And then you can really start to feel this one. So if we really want to get in to that deep tissue area, it just varies on the intensity level and how hard I want to push on poor Sam here.
We typically wouldn't go this far.
Sam just Sam just had it coming.
And speaking of someone that might be in a lot more pain and a lot more sensitive, we have some different tools that aren't near as aggressive. Like this unit works really well on the low back.
So this is a foam roller. I'm sure people have seen just traditional foam rollers before, but it's vibrating. I hope you can see that. It's vibrating my hand. Okay. And this one, we don't have to put much pressure on at all. You kind of just let the roll do the work. And we could put pressure if we wanted to, but just kind of gently moving up and down. And this is nice because it spans the whole entire back. And just kind of going back and forth. And again, increasing blood flow, reducing tensions in the area. And this is, like Mike said, this just feels really good.
You can do this all day.
Yeah, if you're in a lot of pain, this is a very gentle technique that can help to reduce tension through these areas. You could even, kind of roll it down through the legs and work all the way down. We could do this with the gun too, kind of work down through there. If I wanted to put a little bit more pressure, I can kind of push, use my hands and push through here and kind of roll up. The nice thing about this is not only could you have someone use it on you, but you could use it yourself. You could put it on the floor and kind of roll yourself over it. So put natural pressure through gravity down through the back of your leg or your calf. You could even roll on your back. I would be a little bit more careful using a foam roller or something like this, directly putting too much pressure on the back, your mid back all the way up to your neck. So it's a great tool, not only for in the clinic, but also at home. This would be another great tool that you can have for self-management. Which, we're showing you all these things. A big part of physical therapy is also on the educational front. So when we bring patients in, one of our big things is showing them not only what we can do for them, but how they can treat themselves. So we talk a lot about posture and different techniques, different stretches that they can do on their own at home. And every single patient that comes in has some type of home exercise program, some type of home management, trying to improve, preventing pain, I guess would be the main thing too. When we talk about posture or like body mechanics, we teach the patients different things to move better, move more efficiently, and move in ways that they're not going to injure themselves. So we're trying to get to that point where we're more preventative as opposed to always reactive. Oh, I hurt my elbow, now we need to fix it. Well, we want to try to prevent those things at the same time.
Great.
All right, Mike, stay there. We're not done with you yet. So we're gonna talk, the next thing we're gonna talk about is KT tape or rock tape. I'm gonna pull your shirt up, Mike.
Yeah.
It has multiple benefits for us. So it looks like this. Multiple colors, doesn't always have to be blue. So what we'll do is we're gonna put this on Mike's back here since he's in this position, but again, we can use it anywhere. We use it a lot with lateral epicondylitis, tennis elbow, rotator cuff issues, patellar tendonitis, knee pain, plantar fasciitis. We can work all those different areas. And what this tape does is it attaches to the skin and sort of pulls that fascia again away from the tissue, again increasing blood flow to help just decrease tissue tension. It usually stays on for 2, 3, 4 days. People can still shower with it on, thank God. You just don't want to rub the area real intensely and it'll stay on. And also, along with helping with blood flow, it can give you some postural cues. So I've had a patient that's worked at UPS before, and he had a lot of back issues. When I put this tape on, you put it at the right tension and length, and when he bends over to pick something up, if he's not doing it with the correct form, you can feel the tape. So it shows him, hey, I'm doing this wrong. I'm putting myself at risk for injury. So we just put two pieces across those lumbar paraspinals, and then this one piece here to help it stick. And it's real easy to do. And like I said, it lasts 2 to 4 days. Most patients don't have an issue with it. And most of our patients really enjoy it.
Another thing.
Medicated or are they just sticky?
No medication.
Yeah.
Nope, no medication whatsoever.
Another thing with tape is sometimes when somebody's in a lot of pain or a lot of muscle spasm, it just helps to relieve just a little bit of that pain too, because embryonically when we're forming, that part of our embryo, the skin and the brain are connected. So there's a very strong connection between our skin and our brain. So if we can put something on the skin like that with a little bit of a stretch that's kind of recoiling and pulling on our tissue, our brain is sensing, oh wow, this is happening down there. We're going to send little signals back subconsciously to try to relax that area. So we have a lot of good results because of that also. It's the same stuff you see the athletes and everyone else wear. We use it with workers and just about everybody a lot of times, depending on if they're appropriate for it. Yeah.
Yeah. Are there any other questions? Because we're going to move on a little bit. I know we kind of rapid fire went through a lot of those different modalities, but we have a few minutes left. So we want to talk about some different posture issues and exercises and things that some of the other things that we do in the clinic. Are there any other questions on any of those modalities that we just kind of ran through pretty quick?
No new ones have come in.
No. Okay. All right. Perfect. So one of the big things that, and I just spoke a little bit ago about trying to prevent pain. One of the big things that in PT right now that we really like to focus on is posture and body mechanics, especially with the coronavirus pandemic this past year. We had a lot of people using more computers, sitting at home a lot more. And what we saw was an increase in people having neck pain, back pain, shoulder pain from some of the postures that they're, when they're sitting at home. And what tends to happen if I'm sitting and using a computer, hopefully I have really good posture like this, but that's not the case. I preach it every day and I still catch myself in bad postures. But typically what tends to happen is we start to get into this more rounded position, and we start to see our shoulders start to slump forward and our head starts to go up like this. And that can be very problematic for the neck, the shoulders, the back, pretty much everything. And our body starts to stay in this position when we're sitting for a long period of time. And then when we go to get up, things don't just change. Our body's made adaptations, and we start to get more in this position even when we're standing. So that's another big part of the educational process when patients are coming in for physical therapy. We like to discuss that stuff and show them different things that they can do to help with better posture. And we show them exercises and demonstrations and things like that. So that was sitting, when we talk about posture, when we talk about body mechanics, we're standing, and a lot of times people may not pick something up correctly. And so that would be another thing that we would go over in the clinic. So we kind of have a demonstration set up over here. And Mike, you want to talk about this one?
Yeah, sure.
Okay.
That's right. So our first tendency if you ever notice little kids, this is what is really interesting. So really small toddlers always bend their knees to pick something up. But as we got older, they don't really know why a lot of times, whether it's just because we've gotten bigger or because we learned bad habits, we tend to automatically go down to pick something up like this. And they found that if we pick something up like this, the amount of force, like if this is 10 pounds, the amount of force that's transferred right back here is 10 times that amount. So there's 100 pounds of force going right here if that's 10. So that's 100 pounds, there's 1,000 pounds of force that's being generated across this low back right here. That can cause all kinds of problems. So we try to teach people how to lift appropriately to try not to injure their low back, because once you injure your low back, it's most likely that you're always going to have some type of a back issue that you're going to be dealing with. So it's better right off the bat, trying to teach our kids and everyone else to try not to hurt themselves. So we try to teach people how to use good body mechanics. One of the things that we can do is get as close as we can to what we're lifting. Even if you're straddling what you're lifting, you want to be even over that, because the closer you can bring it towards you, the less strain, like we talked about, on your low back. And then everyone knows to bend your knees and keep your back straight. But it's even more important to get as close as you can, because if I'm bending my knees and keep my back straight out here, I'm still generating all that force across here. So I want to be as close as I can. I want to go ahead and bend my knees, keep my back straight. I want to pick that up just like this. Keep it as close to you as you can. Then a lot of people, when they're working on something, and let's say I just pick that up appropriately, but then I go like this and I put it up here. That's not the way to do it, because then your back has to hold that whole weight out here away from you. So you want to pick it up and you want to move and go right up to the shelf or whatever you're putting it on. The same thing with a small child. Especially if your back is hurting, have them crawl up onto something, bring them right towards you and grab them. Always try to keep things as close to you as you can. That's very, very important.
Balance and gait.
Oh, yeah. So would you like to talk about balance?
Sure. Okay, so we have many patients, both young and older, that come to us with balance issues and gait issues, whether it's from an injury or some sort of disease like Parkinson's, and they just have either trouble walking, history of falls, that sort of thing. So we incorporate a lot of different exercises and things to do with balance. Now, as far as balance is concerned, muscles are one part of it, vision, and then equilibrium. So we can challenge all three of those different areas in different ways. And a lot of balance issues start right here at the core. So if we can strengthen the core and then go out towards the legs and things, that helps increase balance. And I thought I thought I saw them bring balance activities out. So various different ways challenge balances to put somebody on a surface that they're not used to. Sam, do you want to demonstrate? So this is a foam pad we have here. So it's obviously not as stable as the floor is. It's actually pretty comfortable to stand on. So the different ways we can challenge the balance, you can just start with basic weight shifts, left to right on the shift, on the pad, and that challenges balance. This is a very basic level for someone that's really struggling. And we also always have these pulls here in case somebody loses their balance. We don't need anybody falling at the clinic. And then that can transition to in just coming up and down on his toes, either holding on or not holding on. And you can see how his ankles are starting to sway because they're not stable as the floor. Good. And then eventually we can even transition into just standing on one leg.
And you can see there,
Yes.
a little bit more difficult.
Yes. And we would do both legs just to make sure. Good. Then we also have even more challenging things, and we're gonna see if Sam's on his A game today. I noticed Mike pulled this out and then backed away immediately because he didn't want to get on it. So this is a Bosu ball, and you can rock back and forth on this thing. You can do squats on this. Good luck, Sam.
I probably need to go away from the wall
A little bit, but then back and forth. And all this challenges the balance, works the core, works the legs, and works every area of the thing. Now he's gonna try and stand on one leg. God bless him.
This would be more for like an athlete, you know, maybe after they went through an ACL reconstruction or something like that, where we're trying to get back some of the balance, some of the proprioception, so as they encounter things in the world or in sports, you know, they're ready as they step. If there's loose gravel or something like that, their body's used to being able to control it and prevent them from falling.
So some of the things you can do at home for this, if you don't have a foam pad or you don't have any kind of a Bosu ball or anything like that, is just standing at the countertop on one leg. Maybe start with your feet close together if you're having really bad balance problems, but have your hands at the counter if you need it. You can even try to stand with one foot right in front of the other at the countertop. That sometimes is hard enough. And then as you progress, just even that one leg, always keeping your knees slightly bent so all your muscles have to work a little bit harder. So, but make sure that you have that surface to be able to hold on to for safety if you need it. So those are some things that you can really work on. As far as gait or walking, you know, I mean, one of the number one things, walking is wonderful for so many different things. So if we're talking walking for exercise in general, exercise is so important. You know, just general exercise, because you're increasing blood flow throughout your whole body. So even if you had a shoulder problem and you go out and you start walking around the block and 2 or 3 times around the block and you start walking a mile and longer, the more you're walking, the more you're increasing your heart rate, the more you're bringing blood flow throughout your whole entire body. So even your shoulder area is getting increased blood flow. So those tissues are going to be healthier. So a lot of times we find somebody, you know, I don't know. I'm really good at being a couch potato, but I know when I'm being a couch potato, I tend to hurt if I'm in that slump period for a little while and I'm not exercising. I know I hurt more and I tend to hurt myself more easily. So we have a lot of people, they might even bend over and pick up a pencil and hurt their back because they haven't been active. They haven't been exercising so that they have enough blood flow that has been bringing that oxygen and nutrition to their tissues. So exercise in general is very important for that reason, just to be healthier and to feel better and to have less likelihood of injuring yourself. As far as walking problems or deficits that you may have with walking, you know, when you come into physical therapy, we do a full evaluation on you and see what's tight, what's weak, what's causing your problem with walking. What can we do to try to help that? Whether it's different types of mobilizations using our hands to try to improve movements of the joints or movements of the back, to try to get things moving all the way up to strengthening your core and your hips. A lot of times we find out that the hips are the weakest thing, more than the knees and the ankles a lot of times, that are causing problems with walking. If you see somebody walking like this sometimes, most of the time, it's a hip problem. That hip is not strong enough to support you, so you're vaulting over that hip to try to stabilize yourself. So we look at all those things to try to come up with a good evaluation and assessment so we can develop a really good plan of care to get you back walking more normally or pain-free.
I see, Billy, we have about 5 minutes left. Are there any new questions for us?
There was one thing that came in that talked about someone with leg pain, and it looks like they're coming up on knee replacement. So that, I mean, that might be more specific to that person, but they were asking if there's anything they could potentially do to help lessen some of that pain prior to getting a knee replacement.
In general, so typically if you're getting a knee replacement, arthritis is kind of done its thing, and you probably have been told there's bone on bone in the joint. By far, one of the best things you can still continue to do when you're in that situation is try to keep as strong as possible. So there probably are some exercises that we could prescribe for you to not only help you at that current state, but probably prepare you for surgery. So after surgery, when you get out, you're in a better place. Typically, the better you are going into surgery, the better you are coming out of surgery. But there are some things that we can do from a modality standpoint that can help to reduce inflammation in the joint specifically.
No, go ahead. I was just gonna show another thing that we can do with somebody that's, maybe heading for a knee replacement, is sometimes, their knee only goes this straight.
Right.
So it may not come down any straighter than this. We're trying to straighten it. It's not straightening. One of the most important things with walking is not so much either before or after a knee replacement, making sure that their knee bends, because we have to make sure that we get that too. But it's that straightening. If you don't have a normal straight leg, if we can't get that knee straight, then you're going to have a much harder time walking normal. You're always going to have a limp. So one of the main things we do in therapy, either before a knee replacement and after a knee replacement, is to try to get that mobility straight. We do a lot of different techniques to really work on getting that knee straight, whether it's through the kneecap, getting some of that fascia with some of those techniques we talked about, all the way to really moving that joint and stretching. But that's another reason, like before a knee replacement, where we can help you in physical therapy, is to try to get that motion ahead of time, along with that strength ahead of time. So then you're going to do that much better afterwards, after the surgery. But yeah, before and after, it's so important. Go ahead. Yeah, go ahead, Billy.
One final question. At the top of the conversation, you mentioned that referrals aren't necessarily needed anymore from a physician and folks can work directly with you. How would someone go about making an appointment to see you guys, and what's the length of time you're looking at if someone were to make a call today? How far out are you guys looking at this point?
Yeah, so one of the things we believe in our company is not the philosophy of making someone wait. So, I mean, we try to stay away from that, because, if somebody's in pain, we need to get them in, and we want to start this process as soon as possible. So a lot of times with our clinics, you're going to find a little bit different, maybe than some other places. We're going to get you in the next day, that day, a lot of times. So we're going to get you in, and sometimes just to even get the process going, we're going to get you in there. We're going to show you some things for home, get a good evaluation in, and start that process. So we don't, you're never more than a couple days out. Really, it's more the patient schedule a lot of times, because I'm one of those people, nope, somebody's hurting, have them come over. I want to work on them and get them better. So we get people right over as soon as possible.
Right. And we recently opened more offices around the Toledo area. And the reason we did that, was so we increased our access to patients, so patients had better access to us. So that allows us to schedule, rather than having one large, huge facility. We have little smaller facilities in each individual location all around the area. We're in Lambertville right now, Waterville, Maumee, you name it, we're probably there, Perrysburg, Sylvania, Miracle Mile, Franklin Park. Yeah. So, we're all over the place, and that really gives us the ability to, if you call us, we can get you in, usually, like Mike said, same day, next day.
Our number, if anyone's interested, is 419-559-5591. That's our phone number. You can go to ptlinktherapy.com also to see more about us and some of the things that we do. And we really appreciate you guys today very much for allowing us this opportunity to talk to you.
I've got one more question. I promise it'll be the last one.
Good.
If you could maybe quickly speak to your collaboration with UT and how you guys work with athletics.
Yeah, go ahead.
So we work with them mainly on like the advertising front at the games. We have an agreement with Learfield.
Yeah,
right.
Yeah, and it's we basically are supporting the athletic department. with that, with our support, we do get like a little banner down on the field. We go to a lot of the games. We set up little tents at like the basketball games or the football games, you know, where we're there talking to patients or talking to people that have questions for us and things like that. So that's been our involvement so far. We'd love to do a little bit more. And we've been, you know, talking with some different people on doing things like this, and you know, just trying to do as much as we can for UT. That's obviously have done stuff for us over the years. So as of now, that's been our involvement so far.
Like I said, we all went to University of Toledo. We believe in UT, and you know, we do send patients quite a bit to University of Toledo physicians, and we work directly with them. Obviously, as Sam said, we would love more involvement in working directly with the athletes, but it's more with the athletes. I know they have their own physical therapy department, so, but it's definitely, we're very happy to support University of Toledo.
And I will say that I appreciate you guys being a partner with the Alumni Association. So for those who are members of the Alumni Association and University of Toledo Retirees Association, there's a partnership we have. So make sure you check them out as often as you can. So I've got 12:01, so we've stolen an extra minute of your time. Joe, Mike, Sam, Chris, I really appreciate, you guys are amazing. I've seen some of the comments in the window that folks appreciate the presentation today. So again, thank you guys so much. If there's anything we ever do to support you, let us know. And again, thank you so much for your time today. To our audience,
Go Rockets!
Right. To our audience,
Thanks,
thank
Billy.
you guys for joining in. Stay tuned for future programs. And everyone, please stay healthy, stay well. So thanks, everyone.
Thank you.